Are you in every way, woman?
We're back with breast cancer prevention and awareness. Now, Dr. Smith, is there something we can be doing to prevent the onset of breast cancer?
That's a great question. And I think, there's a lot we don't know. And there have been lots of studies looking at, for instance, diet. Are there certain foods that women should be eating more of, less of? And all of these studies have been largely inconclusive. There hasn't been shown to be a certain type of vegetable, a certain type of herbal supplement that puts you at higher or lower risk.
Well, I want to get further into the diet in the next segment, but right now specifically, I've heard of these prescription drugs, tamoxifen.
Like prevention drugs?
Yeah, prevention drugs.
Sure.
Sure.
Good question. But to get back to diet, what we find is that maintaining a healthy body weight and maintaining physically active, physical fitness and maintaining an ideal body weight actually has been shown to confer a benefit to patients, particularly those that have been diagnosed and treated with breast cancer, and preventing it from coming back.
Are you saying women who are underweight or overweight have a higher risk of getting breast cancer?
Well, we think, and there have been some recent studies that have been presented at our last national meeting, that by maintaining an overweight or obese body type, there are inflammatory proteins in the body that can increase one's risk of developing a cancer. And we measured those inflammatory markers, and they've gone down when patients have exercised and gotten down to their ideal body weight. And that correlates also with some survival benefit we see with patients who, after having been diagnosed and treated with breast cancer, are able to maintain a healthy body weight. That's been shown, particularly in premenopausal women, to reduce their breast cancer risk by up to 20 to 40% of what it would otherwise
be. So does
be.
the early onset of menopause increase the risk of breast cancer?
Actually, I think it would actually decrease the risk of breast cancer in earlier menopause. And really what we're talking about risk deals with estrogen exposure throughout your lifetime. So we look at a lot of factors, including when you had your first period. Have you had any children?
So if you have your period before a certain age?
The younger you are when you have your period, the longer you have estrogen exposure, so that increases your risk slightly.
How about if you've been on birth control for like 10 years? The shot, for example. Is that
there has not
more
been
risk?
shown to have an increased risk of breast cancer now.
No, especially if it's remote. If we're talking about, years ago, we know there's absolutely, no increased risk.
So do high cholesterol play a part in that? Because I think I might have high cholesterol.
Well, certainly,
I'm just saying I might have high cholesterol.
I mean,
I'm not saying I'm fat or anything.
Yeah, I think that, I always approach my patients telling them that a heart-healthy and stroke-healthy diet is the best cancer diet. And so everything you do to maintain a low cholesterol and maintaining, an active lifestyle and ideal body weight all plays into decreasing risk of cancer.
It's good that you said active lifestyle because anybody that knows me, I'm always on the go. I literally do not have time to myself. Is that something that I should be worried about? Should I slow down? I mean,
never.
No.
Continue being
Never
active.
slow down.
Yes.
Well,
Be active.
I also read a statistic that if you walk a certain number of hours per week, that it actually decreases your risk of breast cancer. Something like 2.5 hours a week or something.
Yeah,
like 60 minutes a day workout time.
All of these studies have looked at different exercise regimens. Some 5 hours of resistance and cardio per week, but even 3 30-minute walks a week have been shown to have great overall health benefit.
So, Dr. Smith, I'm 30, and I feel like I'm going into a menopause. So, should I be fearful, or am I having menopause because I have hot flashes?
I wouldn't worry about your your premenopausal status with regard to breast cancer risk.
Okay.
You shouldn't worry about that at all.
What about postmenopausal women? I mean, are these older women more at risk?
Yes, that's true. And breast cancer is, to some extent, a cancer that's age-related. The older a woman gets, the higher her risk of developing a breast cancer is. And so we do see postmenopausal women having a higher risk of breast cancer than premenopausal women.
What about the estrogen exposure in these, menopausal treatments, hormone treatments? Is that going to increase the risk?
So the question of hormone replacement therapy, essentially, I get lots of questions from my patients on that. And it's taken as a case-by-case basis. If you have a patient who's higher risk, has had a biopsy that's, say, atypical, something wrong with the biopsy. If their risk is high, we tend to say, if you can not take the hormone replacement, that would be best. But my advice to patients is, if you need hormone replacement because of symptoms that are just bad for you, hot flashes, mood swings, everything in moderation, lowest dose possible in order to take care of those symptoms.
Well, could that be said then for fertility treatments as well?
Right. That's a great question to address. We've had recent data that from our last breast cancer conference that shows that probably these fertility treatments do not correlate with the high risk of breast cancer we had once thought in the past. So
that's great news.
Yeah.
Vitamins. What kind of vitamins? Before I know. Should we take any?
Is that safe?
Yeah.
That's good. Good.
It's the best, really.
Yeah. I'd recommend a multivitamin.
Okay.
But
And
somebody
gummies,
was
right?
saying
And gummies?
something about vitamin D as well.
Yes. So vitamin D, we know that the primary importance of vitamin D is maintaining bone health. And so when we talk about postmenopausal women, we think of bone health, and we want to see their vitamin D level in the normal range. If it's in the normal range, we don't feel any need to add vitamin D for anybody. And there may be some benefit in terms of risk reduction for breast cancer. We're still looking to confirm that.
Well, we'll be back with more on breast cancer prevention, diet, and fitness after this. Stay tuned.
So no gummies is good.
Are you in every way woman?